Hello everyone, this is Dr. Scott Friedman. I'm here to discuss with you my focus piece for the January issue of Journal of Hepatology, which addresses a rising tide of concern around the possibility of liver cancer or hepatocellular carcinoma in patients with non-alcoholic fatty liver disease. The title of the piece is "We've Hit the Iceberg," and that refers to the fact that while for years we've talked about the risk of cancer in patients with fatty liver as just the tip of the iceberg, a recent study in this month's issue by Dyson and the group of Helen Reeves at the University of Newcastle indicates quite clearly now that we have actually landed upon the iceberg or hit it, meaning that we are now in the throes of a major epidemic of hepatocellular carcinoma in patients with fatty liver disease. And so this is a real problem that we need to learn more about. In this Dyson study, they examined very carefully accrued health records over a 10-year period of individuals in Northeast England using some very good registry infrastructure from the National Health Service. And that data clearly indicates a 1.8-fold increase in incidence of HCC, which correlates with increased mortality in this region, associated with a striking increased prevalence of fatty liver disease as well as obesity, with now a prevalence of obesity of over 65% in this population. If we return to the liver cancer statistics, they're really quite chilling. Overall, of the cases of hepatocellular carcinoma that were diagnosed, almost 35% had underlying fatty liver disease, which represents the single largest disease etiology associated with this neoplasm. Even more chilling is the fact that of those HCCs in non-alcoholic fatty liver disease, a full 30% occurred in patients who did not have cirrhosis. The clear implication being that if we wait until patients are cirrhotic with non-alcoholic fatty liver disease, we stand to potentially miss up to 30% of cancers until they present more aggressively at a later stage of disease. So the fact that 30% of these cancers arose in non-cirrhotic liver means that we need to rethink our screening efforts in patients with this disease if we're really going to uncover cases that occur before they are too advanced to have potential curative therapies. While the article doesn't look into mechanisms, it is worth thinking a little bit more about the underlying mechanisms that lead to hepatocellular carcinoma in fatty liver disease. And there have been a number of exciting articles in animal models primarily that begin to illustrate how this might occur. And there are a number of pathways that are detailed in my focus piece, but they include in particular the potential role of an altered microbiome in fatty liver disease that leads to uptake of toxic or altered bile acids that in turn affect the stellate cells in the liver and the microenvironment, creating a microenvironment that is far more permissive for the emergence of cancer. There are also other potential contributors that include other features of the microenvironment, as well as vitamin D alterations and a number of potential pathways that I've outlined in detail in my piece. But if we return to the clinical implications of this study, again, I need to emphasize that this represents a real concern of the risk of hepatocellular carcinoma now becoming the dominant etiology in some regions of the world, particularly those where obesity is prevalent and viral hepatitis is not, but also the fact that these cancers are arising in a substantial fraction of patients before they are symptomatic or have cirrhosis. And so to return to the theme of this piece, we have in fact hit the iceberg. We are now confronted by a rising tide of not only fatty liver disease, but the dreaded complications of hepatocellular carcinoma occurring in a large fraction of patients. We've turned the corner onto a problem that we haven't yet begun to solve, except to say that we need to start thinking about screening these patients earlier in their disease before they're cirrhotic if we can detect cancers at a time when they might be amenable to curative therapies, either by ablative techniques or possibly surgical resection or even transplantation. Thank you.